Ash, did you know about Centrix? Have you used their products before? Can you just give us a bit of your background on Centrix?
Yeah, of course. So the main product that I've used with Centrix is actually the Caries Indicator Die. So I've had a little bit of history with that, and it's not. I haven't known like a massive amount about them, but I like the die. I think it's something efficient. It's something that I use as part of my armamentarium already, and it's something where a lot of their other products are, since having an interest in them or looking around and hearing about them a bit more, that's where we got around to talking about the core material.
Yep.
Certainly I've been using that over the last couple of weeks.
Perfect. So up until that point, what core build-up material were you using? What did you like about that material?
So the majority of the time it was either using like smart dentine replacement or sometimes like bulk fill composite materials. And what I liked about a lot of those things was usually the ease of use and more familiarity. It's stuff that I've used on kind of restorative departments in the hospital, and that's often been my go-to, and not really knowing a lot about what else is out there. So having had an idea of seeing what more was out there, that's what made me kind of look into Centrix a bit more.
Yeah, okay. So you can use Encore DC for lots of different procedures, but the main indications are obviously for core build-up with or without a post. What procedures did you use Encore DC for?
The main thing was actually, I used it for its main indication. So exactly a lot of the time I get referrals from endodontic colleagues, and in some of those situations it's appropriate to do like NIACOR preparations, NIACOR cores, and it's really great for that. I find the flowable nature of it, but the fact that it sets quite quickly and really stiff, that's something that can allow you to work with it quite easily chairside. So that's one thing I really liked about it. I've also been using it for just general core build-ups on quite heavily restored teeth. So say for instance, if there was a tooth with lots of caries underneath, had to remove the whole restoration. It's like your old amalgams that we've had to remove, and then replacing that often with the older core materials I was using would be very time consuming.
Right.
Sometimes you're always worried about getting like voids within the restorations as well.
Yeah.
From my experience with Centrix so far, that's not really a concern of mine.
Okay, brilliant. And how often do you find yourself using Encore throughout the week?
I'd say, typically I'm doing maybe, 4 or 5 core build-ups in a week. I'm tending to use that a lot more now, so that's almost become my go-to material.
Oh, okay. And so compared to other core build-ups, how would you describe the application process?
I think it's the ease of mixing. That's really, really nice about it. It's like if you're in a bit of a kind of rush and it's one of these ones where a tooth is broken on the spot and you're kind of needing something quickly, it's just very easy to reach into the drawer and pick this up. It's easy to mix it. Like it's a very fluid way of doing it. I think what I like about the application is the tip is really handy to be able to apply the material, so it flows in beautifully, and this concern of voids, I think part of it is because of the application tip. I think that really helps.
Okay. So a lot of manufacturers describe their core build-up materials as cutting just like dentine. What's your impression of how Encore DC cuts?
I would say it cuts exactly like dentine. It's very. I think the key to this is it sets quick and it sets stiff. So I'm not worried about my burr just kind of going into it like butter. It seems to be, it seems to cut like a tooth, and that allows me to give me like much more accurate preparation. So I agree with that.
Yeah. So compared to other build-up materials, how did you find the Encore DC expressed from the cartridge?
I think it comes out like really flowable. So sometimes concern with other products I found is you're always concerned, has it mixed correctly? And sometimes I've had issues where it would almost like come out in like half powder, half mixture of resin, whereas this comes out really nice and flowable. And I think that makes me confident you're not going to get lots of voids or air bubbles in, particularly if you're doing almost like Naya core type build-ups. I think you can be really confident that you're not going to have the issues of voids within that.
Perfect. So it comes in two different shades. How useful did you find the two different shades? There's a blue and a natural shade. How useful do you find those?
I guess for a lot of the posterior restorations I'm doing, I'm tending to use zirconia, and with that being opaque completely anyway, I find that if you've got something where you can clearly differentiate between what's tooth and what's the preparation, that's great for those posterior preps. I haven't actually used the other shades anteriorly yet, so I haven't had the opportunity to do that, but given the nature of how it cuts, so the fact that it cuts like a tooth, I can be confident it's going to provide a really rigid core even in anterior preparations. So that I think the application for the kind of dentine shade, that would also be useful in those anterior applications.
Okay. And was having two mixing nozzles useful?
Yeah, I think like you say, it's sometimes when a lot of these other core materials you get seem to come through this single nozzle, you're always a bit worried about whether it's all thoroughly mixed together. So I think that I can definitely see an advantage to that, and I would say it has been useful, yeah.
Okay, and following your time using Encore DC, would you recommend it to other dentists?
Yes, I think for someone like me that's very kind of familiar with the materials that I'm using, and often the things that I've used in restorative departments, even materials that I've used in dental school, it's made me realise that there's a lot more stuff out there. So it's certainly one to look and explore. I think if you're finding it, if you have concerns about how your teeth are preparing, especially if you're concerned about the core material being a bit too soft, and you want something that cuts more like dentine, then this is a really good option.
Perfect. Thank you for your time, Ash.